And now I would like to introduce our presenter, Dr. Stephanie Powell. Dr. Stephanie Powell is the Executive Director of Journey Out, a nonprofit organization fighting for the freedom and survival of women and girls in Los Angeles, whose lives have been destroyed by human sex trafficking and commercial sexual exploitation. She was a 30-year sworn veteran of the Los Angeles Police Department, sergeant in charge of Mission Area Vice the last 4 years of her career. Dr. Powell is currently an adjunct assistant professor at the Los Angeles Trade Technical College School of Behavioral Science. Dr. Powell has firsthand knowledge of the fallout created by domestic sex trafficking of both children and adults. Therefore, she and the dedicated staff of Journey Out help to guide those who want to make the difficult journey out of a life filled with abuse and violence. She has been featured in local, national, and international media as a subject matter expert on human trafficking. So I'd like to thank Dr. Stephanie Powell for being here today. And with that, I will hand it over to you.
Thank you very much. I am going to share my screen. There we go. Hold on. Okay, are we all good?
We are good.
Outstanding. So today we're going to talk about the bonds between the trafficker and their victims. A lot of times this is so misunderstood, and rightfully so, because we always think, well, why did she just leave? Or you'll see a girl out there walking, and it could, you'll hear me refer to women a lot, but it's not because women are the only ones that can be victims of human sex trafficking. Men can be victims as well. The problem is that for men and boys, it's underreported. And it's underreported for a couple of reasons. Some are sociological reasons, in that they believe that no one's going to believe them as being a victim, especially when you're talking about an adult male. Or they don't know where to go, because oftentimes organizations will be very gender specific in terms of who it is that they help. At Journey Out, I've made it very clear in all of our printed material, and whenever we're doing presentations, that we are not gender specific, because we really do help anybody that comes through the door. So you will hear me use a female terminology. So when we're trying to understand the bonds, we wonder why doesn't she just walk away? Or if you see a girl on the street, she will pass by a fire station, she will pass by a police officer, and she may never ask for help. And there's several reasons for that. One, she may not see herself as a victim, or she sees that she feels like she is complicit or part of her own victimization, right? So she doesn't even recognize that part. And then the biggest part is that she is very closely connected with a person that's trafficking her. So we also have to remember during this presentation that traffickers can also be familial. We have had clients at Journey Out where it's been their grandfathers or their mothers that have been the ones to pimp them out. So sometimes there's a very close connection, or it's romantic, where they see this person as a boyfriend. And so they know that if they tell, their biggest fear is that that person may go to the jail for the rest of their life. And so that stands behind them. Another way to look at this is when you think of victims of domestic violence, it's the same type of bonding. And so I think that hopefully that helps a little bit in understanding the framework of our talk today. Now, I know that in terms of skill set for you guys and knowledge, I may be talking to some people that are kind of hearing this for the first time, to people that already know it. And so that's where the question and answer period is really going to be important, if you feel that I need to dig into the weeds just a little bit. So I'm trying to kind of go in the middle in order to satisfy everyone's knowledge base. So understanding the bonds between the traffickers and the victims, the purpose of this presentation is for participants to understand how the bond between the trafficker and the victims is established and the barriers that stand in the way of the recovery. Because we all know, again, oftentimes we may be helping a victim of human trafficking, and we have done everything to erase certain barriers, and then they'll go right back. And so we're going to discuss that. Participants will be able to apply their knowledge using case studies. So during this conversation, I'm going to give you some case studies. And at that point, and I know this is going to be hard, it'd be different if we were kind of in a classroom situation. But I know at the bottom of your screen, you have the ability to raise your hand. So if you want to kind of chime in when we do the case studies, please do. And we'll try and get to as many people as possible, knowing that we have a very short period of time for this presentation. Participants will be able to evaluate their knowledge through interactive discussion of solution recommendations. And participants will demonstrate synthesis through interactive discussion on ways to communicate with a victim who has established a trauma bond with her trafficker. So if you could, as we do these case studies, what I would like for us to keep in mind is if you have either been through a situation like this and where you were able to somehow break that bond and be able to better communicate with the victim, I encourage you to please chime in and let us know. So I'm just going to quickly go over what trauma bonding is. So let's go on my right side of the screen in terms of the definition. So trauma bonding is the traumatic bonding which occurs during a cyclical nature of abuse and the emotional roller coaster the victim goes through due to the abuse. The alternative phase of reward and punishment creates powerful emotional bonds that are hard to change. And I know as I was reading that, I am sure if you have worked with any victim in which trauma bonding plays a huge part, not only in their recovery, but who they have become as a result of continuous abuse, I know that their faces have gone into your head. You're going like, that reminds me of so-and-so. And so also, when you look at it, it just screams domestic violence. And one thing to remember that oftentimes when you're dealing with a victim of human trafficking, there is poly-victimization. So she or he does become the victim of domestic violence because they're living with their perpetrator who they feel they're romantically involved in. And so that's just an important thing to kind of remember. So what are some of the risk factors? Well, as we're talking about youth, it could be an unstable home life. Because as we know, traffickers will fill in that need gap. So if someone needs a father figure, that person becomes a father figure. If one values themselves through material items, they will give them material things. Previous sexual abuse. At Journey Out, although we deal with the adult victims of human trafficking, about 80 to 90% of our clients were molested as children. Another risk factor is desperately seeking love and acceptance. I can't tell you how many times you hear this thing of, but he loves me, I can't leave him. Nobody else is going to love me like he does. And the interesting part about it is that they're almost stating verbatim what the trafficker or the pimp has called them or has said to them. And you'll also hear me interchange the two words of pimp and trafficker. And actually, trafficker is probably a nice word for pimp because they're one and the same. One of the vulnerabilities, sharing personal information on social media is a risk factor. I can't tell you how many clients that we have gotten, and even talking to the minors, where they have shared personal information on social media where they have left their self open, in which it's obvious that they're seeking love and acceptance, or the fact that they do have a unstable home life. All of those things, when they're throwing it out there to the wind, the unfortunate part is that those predators that are looking at social media sites will be able to key in on it. Because remember, what they do is they try and fill the gap. Low self-esteem. And also when I talk about risk factors, oftentimes we always think it's those people over there. And we'll have the uh, for some people, the first thing they'll do is do the othering, right? It's the other people that this happens to. I really want you to know that this can happen to anybody. This could be anybody's child. Um, I have had clients that have been daughters of police officers and attorneys, all the way to the gardener or the unemployed. So I think when we really understand that this can happen to our children as well, I think it makes us really pay attention and get a full understanding that this goes through all the lines: race, gender, as well as socioeconomics. So young children, vulnerable women, homeless, runaways, immigrants, the disabled. That disabled part, I can't even begin to tell you that's where the police officer side of me comes out, because that fries me. There have been incidents in Los Angeles where pimps have waited outside of a school to the point where law enforcement has had to do extra patrol around the school to ensure that traffickers are not trying to make contact with youth. And then they will target those that are in special ed classes. And then, of course, the vulnerability as it pertains to the LGBTQ plus. So those are your risk factors. So what usually happens is that the trafficker pimp will make connection, find out where those gaps are, and then the mind games begin. So they may say something like, I've been through the same thing, I can help you. So if the person says, I was in the foster system, they're going to say they're in the foster system. I had a survivor, and I thought that she put it just perfectly. She said, I was 12 years old and I kept running away from home. And I kept running away from home because I was being molested by my stepfather. And I was sitting outside of McDonald's and I was crying. She said, people walked past me and didn't say anything, except for guess who? The person who later became her trafficker. And he asked her, why are you crying? And she told them basically that she was having problems at home. That's when the mind game started. And so he told her that he and his wife would be able to take care of her, and they became her pimp. Um, so uh, that is, to me, an example that just kind of tells it all in terms of how these people will get into the life of these children. Um, they may say, trust me, I got you, whatever you need. I care about you and I'm here to listen to your problems. I think you are the most beautiful girl I've ever seen. You could be a model. Now, for some of us, well, I'm probably the oldest one out of the 292 people that are on this call. But however, you might say, okay, that has got to be the oldest trick in the book, right? You're beautiful, you could be a model. They still use that. So some things have not changed. So this is how the bond games begin. That trauma bond starts, and that person becomes the end all and be all to everyone. I always say if I'm speaking in person, I'll say to the ladies in the audience, we probably all have been there, right? Where we met that guy who is like the best guy in the world. And if you're young, you're jumping out of windows, you're lying to your parents, you're doing everything you can to be able to get with that guy. And he is fabulous until he's not. The blessing is that you weren't trafficked as a result of it. But I'm sure there might be some things that you might have compromised because of the fact that you were in the relationship with that person that you never would have before. So I think when you look at it on that personal end, I think it really helps for one to really understand. And even though you may understand it, you're going to have cases where you're going to say, I don't understand this. I think when we start digging in deep and making it personal and thinking about, okay, there have been times when I've done something that I shouldn't have done. I think when we remind ourselves of that, it puts us back in check of how powerful trauma bonding can become. So some of the psychological impacts of sex trafficking. So the development of complex trauma syndrome, and I'll just talk about that briefly in case there's those of you that are on this call that have never heard of it or are not real familiar with it, I should say. A significant need to help survivors break the trauma bond they feel with their captors. So let me just say this. It's just, again, it's like dealing with domestic violence victims. Even though you may think that this person that he or she is with is the worst person in the world, like they are Satan's best friend, the worst thing you could do is say that to the survivor. Because remember, in their head, they are in love with this person. This is their boyfriend. Unfortunately, in the pimp's mind, he is nowhere near really being her boyfriend. He's using her. He or she is a commodity. Um, and so if you say anything awful about this awful person to the survivor or victim of this, they're going to check out. They're not going to hear anything you have to say because now you have become everything that person who they are in love with have said that you're going to do because you're just trying to break them apart. So I think sometimes it's something that I know I have to remind myself of to keep from making disparaging remarks on somebody's pimp. I just will talk to them as though, okay, um, okay, so this person's your boyfriend. How long have you been with him? And just kind of talking through things, maybe saying some things that will make her think, but never saying anything that would put him down or let her know that I think that he's the next best thing to Satan. Um, there will be suicide thoughts. There will be substance abuse, antisocial behavior. Um, Remember, in terms of the substance abuse, and again, I know for some of you guys, I'm speaking to the choir, that it really is a way of numbing pain. Interesting enough, I was listening to a survivor, and she was saying that she used substance abuse to dull her pain while she was in the life, and they call it being in the life. Um, while she was in the life, and she thought that what she was doing was okay for her own survival. So this is what she needed to do to survive. And in some points, it really she felt empowered by it. She said once she got out of the life, and I she coined it perfectly. She said, I oozed trauma. I didn't realize how traumatic the life that I had been leading and the impact that it had on me until after I got out of the life. And so you will see that. So you may think that someone is out of the life and that they're healing and they're okay. They're going to need just as much therapy as they did while they were in the life because now they are going to have to deal with all of that trauma, all of the things that they may have used substances to numb that pain. As we know, it may numb the pain, but it's still real, it's still there. Sometimes I look at it as when we're helping survivors and victims of human trafficking. You know, we could give them the therapy, we could give them, all right, let me back up. You give them all the material things, find them a place to live, find them a job. That counseling part of it is so very important because when you don't, all you've done is provided someone an umbrella when it's raining. Bottom line is, you take the umbrella away, it's still raining. So you have to make sure that everything that you do for this type of client has to have some sustainability and some substance. Antisocial behavior. Um, I probably, in some cases, have been called everything but a child of God. And well, God knows I was getting that when I was a police officer. But even in the position that I am now, sometimes you do run across antisocial behavior. But being able to understand that sometimes what I'm really, the person that I'm talking to, there's a lot of hurt, there's a lot of pain. Sometimes um, I'll go with rudeness. Sometimes the rudeness may be because it's what they can control, right? It also keeps them from having to feel. So sometimes you may see antisocial behavior. And I'm going to tell you, if you are in this work where people have to say, where the victims have to say, thank you, thank God you're here. My life is so much better because you are a part of it. It does happen, but it doesn't happen all the time. But just know that the work that you do, you're planting a seed. You may never see the fruits of your labor, but when they get older or as they mature, they're going to remember you and they're going to remember the things that you said. So even though you'll see the antisocial behavior, I just really encourage people to try and ignore it and not take it personal, or address it without taking it personal, and kind of leaving the door open. Um, they're going to be distrustful of anybody that's a helper, and they're going to be distrustful of service providers because their pimp is telling them to not talk to you, to tell you not to trust. The pimps are telling the victims not to trust the service provider or the helpers because they're going to say they are purposely going to try and separate us. They are purposely doing this because I'm going to go to jail and I may go to jail for the rest of my life. And I'm sure that that's something that you don't want. So that's the reason for it. So this just gives you just a quick definition of complex trauma. It's traumatic psychological exposure to several stressors that are repetitive and prolonged, occurring at developmentally vulnerable times of a victim's life, such as early childhood or adolescence. Now, please note, if you're working with the teenage youth between 18 and 24, you will see the results of complex trauma. You'll see how it plays out with them, even though these things happen to them in terms of of this of these stressors. You see how it plays out in the young adult as well. So that's what complex trauma is. And so here's the result of what happens to children that are exposed to it. Lifelong problems. Again, this is where you'll see it in the adults as well. Risky behavior, addictive disorder, chronic medical illnesses, I should say mental illnesses, psychiatric disorders. And so these problems may extend from childhood through adolescence into adulthood. So as you could see, and I think this is one thing that we have to often remember, is that, and I could say this for the adult clients, and please, this also transcends into the minor children as well, is that by the time that pimp or trafficker has gotten to them, their trauma doesn't start at the time of that particular meeting. Chronic trauma has probably happened to them way before they meet the trafficker. So what it does, it becomes the perfect storm. And that's how he or she has the ability to lock into these children and young adults and create a bond. One thing that I also want to, just as a side note, for you to understand that the trafficker or pimp does not have to always be a male. It could be a female as well, and the trauma bonding will be just the same. So, human trafficking survivors experiencing early childhood trauma, coupled with additional interpersonal prolonged trauma, is a very unhealthy cocktail. And of course, it leads to things like post-traumatic stress disorder, suicide, environmentally induced bipolar disorder, self-destructive behavior, low self-esteem, deficit in judgment. So they may trust someone and not really using all of their judgment in order to do that. The person seemed nice, the person seemed okay. They told me that they loved me, and so therefore the bond starts to create. And then of course anger. Um, you'll get survivors that will come in, and all you want to do is an intake, and then all hell may break loose because they're going to ask you, like, why are you asking me all these questions? Why do we have to go through this? Am I getting into this program or not? Are you going to help me as my social worker or not? They're angry, but just know they're not angry really at you. They're probably angry at all the systems that they've been in. They may be getting triggered as a result of the systems that they've been in. They also want to stop you, baby, from talking to them because they don't trust you and they've been told not to trust you. So if they get angry enough, they're probably hoping that you're going to throw them out of the office, or it now gives them an excuse to just leave. So just know that this is inherent behavior for a human trafficking survivor or victim. So trauma-informed interventions for working with victims of sex trafficking, a focus on such aspects on basic living skills, decision-making. I think it's really important to really get into helping them with these type of living skills, helping them with decision-making, making sure that you're doing something about their physical and biological health management. Education and career decisions are so important when you're doing an assessment as well as intervention. Developing a relationship, self-care skills, understanding and giving them some alternative ways when they're feeling anxiety, empowerment, collaboration. Um, these things are so very important when you're dealing with victims of, um, of sex trafficking in terms of ways of intervention. Let me just say one quick thing about empowerment that I think that we all need to be careful of, including myself, because we even use the word empowerment in our mission statement. And I started to kind of rethink that word. When I say that I'm empowering someone, it's like I am giving them permission for them to use their power as opposed to acknowledging their power, right? Um, and really encouraging them to use it. But even when I say encourage them to use it, it's as though I'm giving someone permission to use their own power. So that's just something to think about when we use the word empowerment. Look, I'm trying to empower myself to get this arrow right. Okay, scenario one. You got an 18-year-old female who presents at the hospital. She goes to the hospital. She's going in labor with her first child. She's accompanied by two young adults, a female who is also pregnant and a male who identifies himself as the patient's boyfriend and the baby's father. The female companion remains in the patient's room and is supportive. The boyfriend frequently steps out of the room to speak on the phone or to meet privately with other female visitors. Whenever medical staff asked a question, the female would not answer without first looking at the female or the male. So, is there a possibility that this could be a human trafficking, a victim of human trafficking? And if you think that it is, what do you think you need to do in order to, at least at some point, temporarily break the bonds in this in order to be able to talk to her? So this is when you can either go into the chat. I don't know, those that are moderating, would be able to tell me what are some of the answers. So,
Okay, so some of the answers we have coming in. I would ask the other female to step outside while I conduct a one-on-one with the client. Isolate the female from visitors to ask certain questions.
oops.
Get the man and pregnant woman out of the room. Ask for client to answer directly. Ask the help of the other female and male and have yourself or the doctor speak to the female in labor. Separate the patient from the others. Yes, hopefully you can speak with the mother alone. I would want to get her alone for a few minutes, create some space and privacy to inquire deeper about her safety. Report to the traffic line and make sure we advocate for the victim. I would ask the two visitors to leave the room so I could have some privacy with the client. Separate the woman who is in labor from the two others. Also separate the male and other female. Try and keep the patient in the hospital and let the supervisor know immediately. The medical staff could take the client to another room. You would need to get the patient alone and away. If they refuse to leave, use the pretense of a procedure. Ask for a private space for conversation without concerning power dynamics. Engage the female and patient in conversation about safety and care for the unborn child. Slowly build rapport with her and others, gain trust to request privacy to meet with her alone and further assess for her safety. So the female does not feel threatened. I would also tell victim that for privacy, the questions asked are HIPAA protected. And get her alone, build rapport, and see what support they need.
Wow, those are all great answers. You know, when all else fails, I always say you could always fall back on policy. Like you guys were talking about HIPAA. You were talking about a possible procedure that might need to be made. The bottom line is finding some way to separate where it doesn't cause an uproar or confusion. Of course, with COVID, the scenario would probably be a lot easier to deal with, or it probably wouldn't even present itself because they wouldn't be in the room in the first place. But you're right, all of those are really good. And again, if there's some way to rely on policy, I think that's always the best. And then I know, and I know, as you guys were looking at this and as you guys were thinking of answers, the thing becomes, but what if I'm wrong, right? What if I'm wrong? I even like if you have the ability to keep the person in hospital a little longer. The what if I'm wrong, but what if you're right? So I think if there's a way for you to do it and you're able to balance it and it makes sense, or if you are not sure at all, here's what you do have if you're working in the hospital. You have that person's name, you have their address, you have their phone number, and guess what? There's probably going to be a follow-up visit. If you know, if you're lucky enough to know when this person is coming back to the hospital for a follow-up visit, maybe you could ask the questions then in terms of if they were okay. You know, I really love that in some hospital settings and in when you go or doctor's office visits, you know how you have to check, do you have diabetes? Do you have, you know, pre-existing conditions? I saw where in this one doctor's office where it said something, and I know this was geared more toward domestic violence, but I thought it was great. Do you feel safe where you live? or they asked the question about safety. I don't even remember the exact question, but I thought it was great. Because if that person does not check that box when they go in to speak to the doctor or the nurse, that might be a red flag that there might be something going on. So I mean, there's different ways to do this. You may not be able to do it immediately, especially if you're not really sure. But at some point, relying on policy, finding ways to separate, or um, seeing whether or not somebody checks that box, or some additional ways to think of this as well. Okay, scenario 2. Diane is 16 years old and has been on your caseload for 2 years. She's been dating her boyfriend for 1 year, and you have noticed significant changes in the way she dresses and her obsession with material things. She confides in you that her boyfriend will call her names and even sometimes hurt her. She says it only happens when she does not do well the night before. He is not a bad guy. He always says he is sorry and buys her gifts even though he does not have a job. What do you do? And what do you think?
So we've got one person saying they would ask more questions.
What type of questions would you ask the person that put that in?
So we've got lots of responses now. Ask her
Okay.
if she feels safe. Let's see here. Ask her to elaborate on what she's, quote unquote, not doing well and further gauge what this means. Start slow and start at the beginning. I would ask her about her boyfriend in a curious way. I want to know how this is serving her future life. What does she envision for herself? Make a CPS report. More open-ended questions, for example, what does doing well the night before mean? How does he hurt you? Talk about what safety means to her. First, provide resources for Dee Dee. Ask if she feels safe. Ask if she is prostituting herself. Get as much information on the boyfriend as possible, starting with his age. It sounds like it is more leaning towards domestic violence, but it definitely is possible. I would ask more questions and provide psychoeducation on safety. What does she mean by calling names? What does she mean by, quote unquote, doing well? Since I've known her for 2 years, I would be able to comment on the changes I'm observing and ask about what has led to the changes. Are you okay and safe? Can I help you? Try to keep asking until I get an answer. Give her a safe space to open up. Ask if she has a safe place and make a CPS report. I would use mirroring to get more information. I would label her emotions and pause for response. Ask her for a backup plan in case she needs to leave her situation. What does a bad guy look like and behave like? Ask more questions and try to talk to her about what she deserves in a relationship. Ask about the boyfriend, age, behavior, typical days for them. I would ask questions about how she feels in the relationship and how she thinks she is supposed to feel in any relationship, her self-worth. Talk to her about respect, what she wants for herself. I've talked to girls about what would they tell their best friend or daughter in this type of situation.
Man, you guys see me nodding my head. Man, these are some really good ones. So I'm hoping that just based on those answers, that there were some things that you guys hadn't thought of. Man, I mean, they're really great ones. Like I really like the one what does a bad guy look like? If this is your friend in a situation, what would you tell her? Um, it's really, when you're asking those questions in that way, it really screams, I care about you. I care about what's happening to you. Let's talk. Because even though she may give you the answers that you want to hear, that she thinks that I'll answer it this way, I'll get that person off my back. By the mere fact that you asked some of the questions the way that you did, if she keeps thinking about it, she's going to come back to you. And she's going to say, hey, remember when I told you so and so? Well, I lied. This is what's really going on with me. So I really like that. What does safety look like to her? And finding out what does safety look like to her, because I think that's important. I think sometimes when we just react to things, it takes out that that ability and opportunity to really have a more in-depth conversation that will help to establish the relationship, which is part of what we talked about in terms of intervention in cases like this. The one thing that I probably would stay away from is asking a question about whether or not she's prostituting herself or if she sees herself as a victim of human trafficking. She will never probably talk to you again. And then, oh my God, what if this wasn't a human trafficking thing? So just something to think about. I think asking the other questions in terms of her safety, asking her, what do you mean when you say that you didn't do well the night before? What does that mean? That's going to answer the question, hopefully, because based on her answer, you're going to be able to tell whether or not um, she's a victim of human trafficking. One thing that for those of you that are not in the human trafficking community on a daily basis or drenched in it like we are here at Journey Out, we really try and stay away from the word prostitute, because prostitute denotes that there is a choice. When you're talking about a child, there's no such thing as a child prostitute, because the child cannot legally consent to sex, and so therefore it would be not by choice. So just something to kind of remember. Whenever I'm talking to the press, I will tell them, hey, look, I'm telling you, if you say child prostitute, I'm telling you right now, they are going to be on your back in terms of feedback by doing that. Okay, here's a question for you guys. If a child is 12 years old and is coerced or forced into sex trafficking, is that considered child abduction?
Yes, yes, no, yes, yes, yes.
Okay, so give me just a little bit more. Tell me yes,
One
why, or no. Okay.
one says yes because he is underage.
Okay.
No, it falls under CSEC. Did they take them somewhere? It depends on the means the child went. No, taking against will. You can go willingly by fraud. Yes, underage and force. Yes, being under 18 as they are taking the child away into a situation of being forced into the life. It depends on who is doing it. Yes, age of consent. A child cannot consent. Not kidnapping, but child abuse.
Now, for the same people that just answered, would you answer the same way if the child was 17?
Yes. All of them.
Okay. When you think of child abduction, right, and you think of someone taking a child, let's say they do take them somewhere, they do move them. I mean, when you really kind of think about it, especially if I have prosecutors on the line or law enforcement, sometimes getting that pimping conviction, that human trafficking conviction, can be rather hard, especially if you have a victim that doesn't see themselves as a victim. We've all been there, especially if you're in law enforcement. But sometimes looking at it in a different way or reframing it might help in terms of a prosecution. So it kind of gives you something to think about, right? Because when you think of child abduction, they're thinking about how they were taken, where they were taken. The human trafficking is the back end of what happens at the result of them being taken. So I wanted to throw that question out there. And if we had more time, man, we could really get into a great discussion as it pertains to that. But I just wanted to be able to give us something to really think about. So it's just something to remember that when we're building long-term trusting relationships, um, a trusting relationship is really at the heart of this work, which requires time, flexible models of engagement and treatment. So one size does not fit all. We may have to think outside of the box for that person in order to break that bond. That person has to begin to trust you. And that's where it's going to come from. In addition to a group or individual trauma specific counseling, there's ranges of alternate modalities that can offer promise to helping victims build self-esteem. Some of those modalities could be things like dancing, art. There's so many different ways in order to build that self-esteem and trust. Again, the word empowerment. A reconnection with themselves and society. Because remember, even if they have built up this self esteem and have done all of the work that they need as an individual, there's still going to be some angst in terms of how society is going to see them. How's their parents going to see them? How are their friends going to see them? Because while they're in the life, as we know, prostitution um, is one of those things that creates a lot of judgment. So, in order to break these bonds, it really is going to take trust. It's going to be long term. It's got to come from your heart. You have to always be authentic and be flexible in your modality. So let's open it up to questions. We have 10 minutes for questions.
Okay, so I have a few questions that have been submitted, and I'll just go through them. First one is, what if the teen doesn't understand that she is being sexually exploited due to a disability that impacts social understanding, like auditory prosodic deficit, and the child has run away but thinks they are helping her?
Wow. Okay. So, and you know what? I know as that question was being asked, a lot of you were going like, "Yep, I've had that issue." I think what in terms of this, and I don't have expertise as it pertains to um, uh, special needs, but my gut feeling on this is that you already know that this person is being exploited. You know that. Um, you don't need for them to know it in order for you to be able to help them. I think you have to figure out what is the gap that that person has filled for them, and you be able to fill those gaps. So again, getting away from the fact that they were trafficked and coming up with some type of modality that is going to help things like self-esteem, help them feeling better about themselves. Figure out what was that gap that they needed, having them feel that they are okay. And of course, you're going to have to do that within the framework of working with someone with special needs. So I hope that helped, because lots of times we get locked into this is a victim of human trafficking. I need them to understand that they're a victim of human trafficking, because if they don't understand that, I'm not going to be able to help them further. if you could forget just that part, because you already know that, figure out what is going on inside of them and those things that you'll be able to help them with. Okay, next question.
Thank you. What have you found to be the most effective interventions to help a victim build a new life without abuse?
I think it goes back again to that self-esteem part. You know, we at Journey Out, we do art therapy. Um, and you could see the aha moments. Like we had them do something simple like a board where, you know, of course, you know, you have the they could put in their own they could write in their own things on a strip of paper, or they could pull pictures from magazines. But here's what it had in the middle. It said, I am. And then they just would have to 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 pull out strands from that in terms of who they are. And you could see the aha moments with them getting back in touch with who they are. Because you know what? That pimp or the girls that are in their particular stables, nobody's asking her who she is. But when you say I am and have them dig into who they are, it helps for them to reconnect with their inner self. And that really helps in terms of the self esteem issues. Now, keep in mind, all of these things and questions that I'm answering, there are some people where you do the I am and they are good. They walk out of the door, ray of sunshine, it's okay. Just know with some people, it's going to take longer. They're going to walk out the door and it's still going to be rainy. But when they come back, you just keep building on the foundation that you laid. Next one.
What can we look for during crisis or DV radio calls that may signal someone is a victim of human trafficking?
I'm going to give you a perfect example, and I'm assuming that it's coming from a police officer, I'm guessing. Um, I don't know if you guys remember or heard about this. Uh, uh, it was a female pimp. Her name was Pretty Ho, and she was really recruiting minors out of South Central LA. How they got her, she's a female pimp, how they got her was on a radio call. And the radio call was that uh, the woman runs out of this, it was an 18-year-old. She runs out of this apartment, and because some type of substance was poured on her, it was bleach. It was bleach. When the officers got there, they tried to speak to the victim, but the male and female that answered the door of the apartment would not let the officers speak to her. Um, and of course, you know, the officers insisted. In fact, I think I know what it was. They said that she wasn't there. The officers didn't just leave. They kind of looked past and could see that there was a female. They said, I want to talk to her. Eventually, they were able to work their way into the apartment. They were able to talk to that victim. Once talking to that victim, they found out that there were other victims that were being pimped out as well, that were minors. They were able to make that arrest. As a result of that, Pretty Ho ended up pleading out to 15 years. So, you know, she pled to 15. You know, she was looking at some hellacious times. So I think it's just like the scenario that I showed you at the hospital. Um, when something and you know people that answer radio calls, regardless of whether you are a police officer or a social worker, go with your gut. If it doesn't feel right, it probably isn't right. You just need to do some more digging. So I would say that when you're encountering someone who other people are speaking for them, who you know have the ability to speak for themselves, I think that that is a huge red flag. I hope that helped.
Thank you. Next question I have is, how long does it take to break this bond?
Whew. It depends on it really depends on the person and if they're ready. Um, and I say if they're ready because we do empowerment groups here at Journey Out, and you will have some girls that will sit in that group and they will be very quiet. And we might have them anywhere from a month to 6 months where they're coming in. After 6 months, sometimes you'll see a different person. After 3 months, you may see a different person. And so that's why I always say plant the seed, because they themselves are going to determine the length of time. But when you plant that seed and you keep building upon that foundation, that's when you start seeing the breakthroughs. And when they have the ability to trust you, you've created a safe place where they can be vulnerable and where there's no judgment. That's where you will start to see, you are going to start seeing the taking down the bonds. You're going to start hearing them saying stuff, you know, I never thought I was a victim of human trafficking. I've heard of it before, but now that, you know, from what you're describing and what I'm seeing in my life, I think that could be it. I thought that he really did love me. I didn't realize that it was um, uh, just a way to suck me in even further. So I think it takes time. The question then becomes, how long does it take for someone to really genuinely begin to trust you? Because once you start to build that trust, then that's when you're able to start to take down those barriers that are going to get in the way of that person being able to move forward.
Thank you. Okay, I think we've got time for two more. So
Okay.
I have one that says, since I work with non-minor dependents, if they are 18 and are sexually trafficked, what would the legal consequence for the NMD?
What is what is it? M what?
Might be a typo. What would be the, let's go with what would be the legal consequence
For the
for the
victim or
non-minor, sorry, for the non-minor dependent?
so the bottom line is regardless of whether they're 18 or they're 25 or 30, um, they still could be considered to be a victim of trafficking. Um, and irregardless of their age, their perpetrator could still go to jail for, and so I'm just talking about a legal consequence, could still go to jail if that over 18-year-old is willing to make a police report and willing to testify. So those are the consequences. Victims of human trafficking, there should be no legal consequences. Victims of human trafficking should not be getting arrested. They should be getting offered services. And that's why it's really important for law enforcement to work with a non-profit. Here at Journey Out, we work very closely with the Los Angeles Police Department to this point. Man, have I seen a shift. If they get someone who is initially being arrested for prostitution, um, they can either, regardless of whether they identify as a victim, or if they say a victim of human trafficking, or they say, I want out of this life, I want help, they don't get arrested. We are contacted and then we provide services. I hope that
Thank
answered
you.
the question.
Um, how are people with disabilities handled in this situation since they won't be able to decide by themselves?
Wow, you know, and of course, you know, to me, and it just me and the way I'm wired, nothing is impossible. I think that's why we talk about alternative modalities. Um, we've got to find ways. We got to find ways to continue to help them, whether that's through a guardian, whether that's through specific counseling that would be specific to them and their needs. But we've got to do something. We can't just chalk it up. And I'm not saying that the person asking that question would do that. Because guess what? That trafficker, that's why he is targeting someone who has a special needs with the belief that she'll never tell, nobody will be able to figure this out, and therefore nothing is going to happen to them as a result. To them, they see them as an easy target. And so we have to make that person not an easy target and come up with some ways to be able to communicate with them, to be able to find out what's happening to them, and to be able to come up with modalities that are going to be helpful to break down the barriers that are needed in order for them to move forward.
Thank you. And Dr. Powell, if you have time for just one more,
Yes.
They'd like to know, do you find that when the trafficker is a family member rather than a stranger, it is more difficult to break that bond? I understand it does depend on the person, but I have seen clients really struggle a lot when it was a family member.
Oh, absolutely, it's hard. What if that's your mother? Think about, when I was a police officer, I worked child abuse, and you'd have these hellacious child abuse cases. And then let's talk on physical abuse. That child still loves that mother because it's their mother, regardless of whether they burnt them with cigarettes or regardless of what they have done to them. It makes it extremely hard. And so it goes back to if we vilify the mother, you now are not going to have any trust factors with that victim. So absolutely, it's hard, and that's when you got to put your thinking cap on and be thinking outside the box and building that trust without vilifying the other person. Absolutely, it's very hard when it's a family member. But I've also have dealt with survivors where it's been a family member, and where this is the point they get to. Even though my mother and my grandfather did this to me, they pimped me out. That was horrible what they did. I long to have a relationship with my mother or grandfather, but however, I still keep a certain amount of distance. So what they eventually learn is that although it's not going to be the healthiest of a relationship, they set boundaries, right? So they now have set boundaries. I could still love you, but these are the boundaries that I'm setting. So I think that when you're leaning that way in terms of helping someone when it's familial, I think that is a good direction to go in.
All right, well, I want to thank Dr. Powell for your time and answering all the questions. I know we weren't able to get to everybody's, but I appreciate everybody that did submit one. We will be mailing certificates of attendance out to you along with closed captioning transcripts and a PowerPoint in a PDF, and we will send that out to you this week. And this recording will also be posted to CIR's website within the week. So you
And
will be able to access it if you missed anything.
and do they have my email address? Will they have it?
We can absolutely include that as well.
Absolutely. If you have any questions, if you have any clients that are adults that need services, please contact us here at Journey Out.
Thank you so much, everybody.
Thank you.